Have you ever wondered if the well-meaning medical care you or maybe your aging parents are receiving might actually be secretly doing more harm than good? Well, welcome to this explainer. Today, we're pulling back the curtain on the medical establishment to explore a fascinating and frankly kind of shocking reality. We're going to look at the specific medical procedures, the tests, and the surgeries that doctors actively avoid letting their own families undergo.
We've all been there, right? You're sitting in the clinic, maybe feeling a little anxious, and the doctor recommends a test or a procedure. And because they're the expert in the white coat, we usually just nod and blindly accept it. We rarely understand the true implications, the hidden physical tolls, or the fact that maybe, just maybe, there was another way. The information gap between patients and doctors is honestly huge, and it often leads to us making choices out of fear rather than informed confidence.
So to really bridge that gap, this explainer is grounded in the insights of a highly credible insider, Dr. Kazu. He's a former university associate professor and an active neurosurgeon. I mean, this is someone who spends his days operating on complex, life-threatening cases like strokes and brain tumors. He has seen the medical system from the absolute highest levels. And let me tell you, when a surgeon who literally cuts into brains for a living tells you there are procedures you should avoid, it's definitely time to pay very close attention.
All right, here's our roadmap for today's explainer. We'll be covering 1. The truth of avoided medicine. 2. The hidden risks of unnecessary tests. 3. Excessive surgeries needing caution. 4. Why excessive medicine happens in the first place. And finally, 5. How to protect your family.
Okay, starting with Section 1, the truth of avoided medicine, or the core medical philosophy.
Look, the fundamental reality of medicine is that absolutely every single medical procedure, no matter how excellent, involves a trade-off. There is simply no such thing as zero risk. It's this constant, delicate balancing act between the medical benefits on one side and the physical invasiveness and side effects, the risks, on the other. Medical professionals know that sometimes the damage done to the body actually outweighs the medical benefit. True professionals are constantly weighing that cost-effectiveness against the limits of safety. That's something we as patients often completely forget in our urgent quest to just feel better.
Moving on to Section 2, the hidden risks of unnecessary tests. This is really about the illusion of safety.
Think about a CT scan. Whether it's of your head or your whole body, it exposes you to hundreds of times the radiation of a standard X-ray. Hundreds! Dr. Kazu points out that while CT scans are incredibly useful when you have clear symptoms, like a sudden severe headache or paralysis, taking them repeatedly just to relieve your own anxiety is actually completely counterproductive. Getting a brain scan when you have absolutely zero symptoms might feel like you're being proactive and safe, but you're really just absorbing a massive, totally unnecessary dose of radiation.
And honestly, radiation isn't even the only risk here. Overtesting leads to this fascinating and highly frustrating phenomenon known as an incidentaloma. This is a tiny, harmless abnormality discovered purely by chance, just because the machinery we use today is so incredibly precise. These tiny anomalies would probably never cause you a problem in your entire life, but once the doctor finds it, well, they have to tell you. So now, you're dealing with the psychological harm of anxiety you didn't even need to know about. And that often sparks a chain reaction of even more unnecessary invasive testing just to monitor a completely harmless quirk of your anatomy. It's wild.
Let's dive into Section 3, excessive surgeries needing caution. We're talking about the point of no return.
When most people hear the words brain aneurysm, they panic. For sure, they think there's a ticking time bomb inside their head that needs to be removed immediately. But Dr. Kazu explicitly warns against jumping straight into a major preventive surgery like a craniotomy for a small, unruptured brain aneurysm, especially for the elderly. Age, pre-existing conditions, and the actual statistical risk of rupture really have to be weighed here. In neurosurgery, regular observation using MRIs is a highly valid, widely respected medical choice. Doing a massive surgery purely for prevention, that's something he would absolutely not recommend to his own family.
So, the crucial point here is understanding the proper escalation of care. It's a very specific order you should follow. Number 1, try conservative treatments first. We're talking lifestyle improvements, stretching, and rehab. Number 2, try medication. And then number 3, only as an absolute last resort, surgery. You really should push those non-cutting options to their absolute limit. Why? Because the very moment a surgeon uses a scalpel, you are introduced to irreversible risks, things like severe infections and permanent after effects that you can literally never take back.
All right, Section 4, why excessive medicine happens. Let's look at the systemic flaw.
It really comes down to a structural clash in the medical system itself. On one side, you have the patient's assumption that more tests automatically equal more safety. We demand tests because we're anxious, right? On the other side, you have the doctor's mindset of defensive medicine. Doctors often order excessive tests and jump to procedures simply to avoid missing something and facing potential trouble or lawsuits down the road. Because of this dynamic, a doctor who actually looks at you and suggests doing nothing and just observing, they are often the one truly acting in your best interest. They're braving your potential disappointment to save you from unnecessary harm.
Which brings us to our final section, Section 5, How to Protect Your Family. Consider this the patient's playbook. Okay, I want you to memorize these 3 exact questions. Dr. Kazoo arms us with these to ask whenever a procedure is recommended. First, what exactly happens if we don't do this test or surgery? Second, are there non-surgical options or can we just observe for now? And the third, this is the ultimate trump card. Doctor, if I were your family member, would you recommend I do this right now at this exact timing? Asking these questions demands transparency. It pulls the physician out of their routine and forces them to look at you as a human being, not just another case file.
Furthermore, please never forget that second opinions are your fundamental right as a patient. If a major surgery is proposed, do not worry for a second about offending your current doctor. A true professional won't mind at all. Dr. Kazoo advises that you should actively seek out opinions from hospitals with a high volume of cases for your specific issue. Bringing in multiple perspectives is honestly the only way to ensure you're making the absolute best choice for your family.
Now, let me be incredibly clear here. The takeaway today is absolutely not to avoid all medicine. There are absolute emergencies where you must act instantly. If you or a family member experience a sudden, severe headache, sudden numbness in the limbs, or speech disorders, you need urgent testing immediately. No questions asked. This is exactly where modern medicine shines, and early detection in these specific instances directly saves lives.
So, to sum it all up, the ultimate takeaway from this explainer is this brilliant little quote: what is needed, when it's needed. The whole idea that more medicine is always better is a dangerous myth. True medical care requires careful timing, strict necessity, and a really deep understanding of the risks involved. You have to become a smart, active participant in your family's healthcare. You need to discuss things with your doctor until you are completely, 100% satisfied. So, I'll leave you with this final thought. Knowledge is your greatest armor. The next time you sit in that clinic and a major test or surgery is recommended, are you ready to confidently speak up and question your physician? Think about that for a second. It might just save your life or the life of someone you love. Thank you so much for joining me for this explainer, and remember, keep asking the right questions.